Listen up, get ready, I'm not gonna take no more. There's a revolution, a revelation going on in my soul. Buckle up, get ready, we're not gonna sit back.
Okay. My first two guests, as I alluded to earlier on, are good friends Mary Driscoll and Dr. Ellen Mason. And they will fill you in a little bit more on what they do. But I know Mary, besides having been in Rising Up Angry and run the Free People's Health Center, she is a lecturer in public health, critical thinking in public health at UVI. And Ellen teaches at the School of Public Health, and she is also a doctor at Cook County Hospital. So good morning to both of you. I'm so glad to see you. You are two of the people I really like in the world a whole lot. And hopefully you'll share some information on what's going on in the world of healthcare. We hear a lot about it in the news, and a lot of us are in need of it. And spill the beans, sisters. Go ahead.
Okay. Well, I guess I'll start, and then I'm just going to start by saying a little bit more about myself and just some thoughts on the overall healthcare system. Then I guess Ellen will do the same, and then I'll maybe talk about some other things. Micah will ask me questions. Okay, so I'm Mary, and I'm a nurse, and I have worked most of my working life at Cook County Hospital in various iterations. One as the perinatal coordinator, the director of nursing for HIV/AIDS, the nursing director and director of patient care services for all of the ambulatory services at Cook County. And then in my almost retirement, I went over to the state of Illinois Department of Public Health, where I created the Division of Patient Safety and Quality and was the director of that. I was also appointed to the Cook County Health System Board and served on that for about 6 years from 2017 till 2017 till about 2022.
1917 was the Russian Revolution.
I know, yeah, geez. Hey, would have been fun to be alive then, maybe. Okay, so let me just say a few things about my thoughts on the U.S. healthcare system. First of all, it's broken. I think we can all agree with that. The U.S. healthcare system is broken. All other wealthy countries have some form of universal health insurance. And not only is our healthcare system broken, it's more expensive than other wealthy countries. The second wealthiest country, we pay 2 times as much per person for healthcare as the second wealthiest country. And yet we have much, much less good health indicators. And those are the health indicators by which the world measures the health of a nation. So our life expectancy is lower, infant mortality is higher, maternal mortality higher, obesity, chronic disease higher. If you're a working class person, your life expectancy will be 10 years lower than that of a wealthy person. In Chicago, if you live in West Garfield, you are likely on average to die at 67 years, and that if you live in the Loop, you're on average likely to live till 87. That's a 20-year gap in life expectancy. So we should all be angry about this. Why shouldn't we be? Healthcare is a human right, not just a right for the wealthy. However, we do have a system in place that covers everyone in a classification, Medicare, and covers all seniors. So what should we have? Medicare for all. Many people, Bernie Sanders included, and myself, think that with the way we should go in this country is Medicare for all. Now, with the current administration in Congress, we know that's not going to happen anytime soon, but it's something that we should keep pushing for and keep talking about, even as we still continue to support small reforms that will make people's lives better and easier for them to get health care. So to be a healthy nation in this country, the major thing we need to do is to stop running healthcare as a business, a for-profit business, and having it become a human right. So just at the end of this, let's honor Quentin Young today, who was really a proponent of a national health care. And his mantra was what? Everybody in, nobody out. Let's all say it. People at home, you can say
everybody
it too.
in.
Everybody in, nobody out.
Everybody in, nobody out.
Okay.
Right on.
That's it for me. I'm going to give it over to Ellen, huh?
Okay, well, I mean,
Hi, Ellen.
hi. Yeah, I couldn't agree more with Mary. So a couple words about me. Yeah, I'm a doctor. Was a doctor earlier in my career at the University of Chicago and at Rush Medical Center. Got really fed up and tired of the bullshit that's associated with our crazy, fragmented, expensive, and poorly run healthcare system, and came to County, where I've spent the majority of my career too. And I think being in healthcare is really radicalizing, because it's like light coming through a prism. You see a lot, and you see the components of light. Some things are ugly, some things are beautiful. Racism, discrimination, poverty, greed. And then on the other side, you see the glories of public health, which Mary was just describing. And you also see the potential for a good system to really impact on people's lives, to support them and help them thrive. And so that's really what we do need to shoot for. And yeah, like Mary says, we could do this. We could do this. Everybody else is doing it, not just wealthy countries. And you think about it and you say, oh, how could we do that? And you go so I'll give you a good example. My husband's family's from Italy, and some years back we were there with the kids, all the nieces and nephews. They scaled a chain link fence to get into a soccer field, and my niece fell and smacked her head on the concrete. There we are in Milan. Take her to the ER. They do everything. See a specialist, get a CAT scan. Did we get a wallet biopsy? Did anybody ask us if we could pay? No, she just got the care. We didn't pay anything. And that's what we really need. A healthcare system that does that takes care of people, supports people, and doesn't waste any money on administration and bloated profits. So, yeah, I mean, I feel like we can get that, but we need to do what we can right now to minimize the damage of what's coming down. And Mary's going to give a lot of background on where we are and how we got here, so we can talk about that. Because I think everybody has skin in this game. Whether you think you're impacted now, I think by the end of this segment, you will know that you are impacted regardless.
Let me just throw in here that I've heard that story from other people who've had injuries, accidents in other countries and have been taken care of with no charge. And so, here we get bills. They take it out of our Social Security for Medicare. If you have supplemental, they take money too. You have to pay some money each time you go. It's crazy. And it's too bad. Mary, before you go on and tell us a little bit about the history of Obamacare, tell us, our listeners and viewers, who Quentin Young was.
Okay, I would be happy to do that. And you knew him too, Michael, so you should jump in. Quentin Young was a doctor, and he was many things. But I guess first and foremost, he was a radical activist doctor, and he believed in a national healthcare system for all. And he devoted his life to basically working towards that. He was way back, I don't know how far you want to go, but he was questioned by the House on Un-American Activities when McCarthyism was rampant in this country, and because of his beliefs around the national health system. He was the director of medicine at Cook County Hospital for a while. He founded an organization called Physicians for National Health Care. He organized doctors to work in free clinics. He organized doctors to be available at demonstrations to help people who might get beat up by the police. He founded an organization called Health and Medicine Policy Research Group, which still exists today and is one of the foremost advocacy organizations for healthcare in our country.
Yeah, and I know he went to Mississippi and was real involved bringing doctors down during the civil rights era in the South. Okay, well, we had this long battle way back for Obamacare, and, they're still debating the Affordable Care Act or Obamacare. And why don't you talk a little bit about it, what its history is, what's good about it, and what's not so good about it, and where we're at.
Right. I'm going to talk a little bit about the history. And when I say a little bit, I mean I'm going to be brief, because it's really was a complicated complicated reform act for healthcare. And partly it was so complicated because of the pressures of the Republicans in Congress cutting back at everything that the Obama administration wanted to put into this act. The Republicans wanted to cut it away. So we ended up with having a sweeping, broad kind of reform act. But it has been under attack from the Republicans and the Trump administrations, both Trump administration 1 and 2. People being able to afford it was the major cause of disagreement between the Democrats and the Republicans that led to the government shutdown, the recent government shutdown. And Congress is going to be continuing to fight over these things for quite a while as to whether or not people are still going to be able to get some piecemeal affordability or not. And Ellen is going to talk much more about this, but just a little bit about why it's important, because it's really important today for what's going to be going on in Congress. Okay, the ACA passed in 2010, and it was fully implemented in 2014. It was passed first and foremost to provide coverage for many more people through a Medicaid expansion and through health insurance exchanges. But it had other purposes as well. One was to increase the affordability of healthcare, and another was to also improve the quality of healthcare through regulation, efficiency, and making healthcare organizations more accountable and transparent to the public. So these were lofty goals, and the ACA, the Affordable Care Act, or Obamacare, had a good start at this. But the ACA was, at the end of the day, not enough and too complicated, and subject to a lot of pick-aparts by Republican governors, the Congress, and Republican administrations. But it was broad in its scope, and this is why it was really important, because it was broad in its scope, and it began to address some of the wrongness in our healthcare system. Some of the important changes that the Affordable Care Act made were it expanded Medicaid for adults up to 138% of poverty, and it created these health insurance exchanges that had some regulation over insurance companies. Whereas before these exchanges, if you didn't have any insurance through your employer, or you didn't have Medicare or Medicaid, you would have to go out in the world and seek out these insurance companies and see if you could get a policy. And you were at their mercy. They had all kinds of restrictions that maybe they'll insure you, maybe they won't, maybe they'll charge you more, maybe they'll charge you less. The insurance exchanges ended all of this. The insurance companies could no longer deny people insurance because of pre-existing conditions. So if you had, say, for example, cancer, or if you had diabetes, or if you had a mental health issue, the insurance companies could have denied you the right to an insurance policy. The exchanges ended that. They also allowed for coverage of young adults up to age 26 on their parents' insurance. Many of us have many young adults took advantage of this, and many parents were very grateful for this as well. Yeah. It also mandated that insurance companies pay for preventative services as designated by the U.S. Preventive Health Task Force. There were no lifetime limits on coverage any longer, and basically no restrictions on annual coverage. It also began to fund the process of ensuring quality health care. It created medical homes and medical managed care coordination services. It funded healthcare organizations to behave in a more team-centered approach to care, mandated that hospitals and healthcare organizations measure quality and publicly report it. In Illinois, we have an Illinois hospital report card. People can go online and Google that, look it up. Very interesting. You can see what the hospital that you go to, what their quality indicators are, including nurse staffing, what their nurse staffing is, which is a big deal, because that's one of the biggest problems in healthcare is staffing shortages. They provided funding for school-based health centers. They gave tons more money to the community health centers that many people go to. And those community health centers expanded greatly. And they now provide dental care and provide mental health care because the Medicaid portion of the ACA now provided funding for mental health care, which previously was not available through Medicaid, nor dental care. So Medicaid options to promote there were also options to promote community care for the elderly under Medicaid. And if you were the spouse of someone who was seriously ill, to keep you from becoming impoverished. So, and in a sister health bill, it provided for information exchanges, whereas healthcare organizations would have, all healthcare organizations would have access to the records of all other healthcare organizations. So if you were someone who showed up in an emergency room somewhere in Minnesota, somewhere in southern Illinois, but you were from Chicago and all your medical records were there, they could access them and find out what was going on with you. Okay, this was a big deal. Communication and care coordination is a big deal in healthcare. And unfortunately, when Trump won in 2016, and if you also remember, Illinois at that time had gotten a Republican governor, Bruce Rauner. A lot of these fundings for the quality parts of the ACA were lost. And what remains is not insignificant. What remains are the Medicaid expansion and the healthcare subsidies and some of the regulations on insurance companies on these healthcare exchanges. So even though the ACA could not survive, its goals of increasing coverage and affordability did survive. And I'm going to try and speed this up. So it really provided for Medicaid expansion, which gave millions more people access to Medicaid and also gave millions more people access to health insurance through these exchanges. Under the ACA, 20 to 25 million people more people now receive Medicaid through the expansion, and about 20 million more are enrolled in the insurance exchanges. That's a lot of people. I'll skip the part about Illinois. So again, Medicaid expansion allowed for single adults up to 138% of poverty sign up and get health care. There were reasons that this was affordable because the federal government almost fully funded this for Medicaid. But the second part of increasing coverage, the part that we're really involved in now, are the health insurance exchanges. And they allowed you to purchase insurance by choosing from one of four plans which provided different levels of coverage for people. Initially, all the plans were eligible for some sort of subsidies based on incomes up to 400% of poverty. So this was not nothing, but it was still expensive and still more unaffordable to many people. But under President Biden and the American Rescue Plan, the subsidies were increased. So even families at 400% of poverty could qualify for some assistance. And he also importantly increased the subsidies for people with lower incomes who are already eligible for subsidies. And this made the Affordable Care Act highly affordable for the 24 million people who are now enrolled and who don't have employer coverage. These subsidies or tax credits are set to expire actually today. And this is this will hurt people very, very much. And before I end, let me say that the states that have doubled and tripled enrollment in the exchanges are mostly red states. It's Georgia, Louisiana, Tennessee, Texas, and West Virginia. Many, many people will be hurt, and they will lose health care coverage when these enhanced subsidies that were provided by President Biden expire today. So Ellen is going to talk more. I'm sorry I took so long.
Oh, that's okay.
But
we need
really
this information.
Complicated, and I didn't even get into some of the things I wanted to say because this stuff is so complicated.
That's why I ask you guys to come on a regular basis because there's so much.
We can always do that. We can always do that. We'll come back. We're so honored to be here. We're so honored to talk about this stuff. And Mary's summary was terrific. And yeah, so here we are. We're facing a cliff. I mean, the big barbaric bill that passed in July, not beautiful, barbaric, takes away healthcare from a lot of people. But they didn't address the issue of the subsidies expiring. And so the Democrats said, okay, we want these subsidies to continue at least for some years while we figure things out. So the Democrats refused to sign on to the appropriations bill that we needed to fund the government. And so there was a shutdown this fall, and the shutdown went on. And, you can think what you want about the 8 Democrats who crossed the line and said, okay, we're going to vote for the appropriations bill on the hopes that, and this is so important, that in early January or this coming month, we can talk about having a vote on extending the subsidies, because otherwise 22 million people are going to lose health care and access to health care. You're going to have the healthy people peel off the young people and say, I'm not going to buy any of these plans. I'm too healthy. And you're going to have the older people, 50 to 64, who can't get Medicare yet, saying, I can't afford any of this. I can't have health care. And so it's going to be a huge mess. So we really all need to be ready to fight and to work and to call legislators and to talk to people who vote and to communicate with people in other parts of the state who don't necessarily think what we think, because we really need people who have less to be able to get health insurance. And don't kid yourself. As I said at the beginning, employer-based insurance rates are going to go up because the insurance companies say, okay, we can charge more now. We're going to charge everybody more. And Medicare is going to cost more, especially because hospitals and providers are going to go out of business as this thing unfolds. So this is a critical fight that we're all in. And people need to learn about this the way they learn about civics in school and take it really seriously because their lives depend on it. They really do.
Wow, that's something else. Well, I want to thank you both for coming on live from the Heartland. I know there's so much more to talk about, and hopefully we can have you back next month.
Thank you so much.
All right. And just before we go out, just give us a real brief thing about what we can all do to help make healthcare a human right.
We can keep pushing and talking about things like Medicare for all, keep pushing and talking about how healthcare should be not a big business, that it's the right of people, and also pushing for smaller reforms like Ellen was just talking about, things we should do around keeping these subsidies and tax credits.
That's just like a regular newscast where at the end they kind of go over what was already talked about.
Right. Dismantle the health industrial complex. Come on.
Right on. Dismantle the health industrial complex. Okay, everybody.